Hello sir, my name is Nazarin Himanday and I'm going to be your student nurse for today. So may I ask what is your name sir?
Axel Alcanzare,
And your birthday?
August 29, 1983.
Okay sir, for today I'll be assessing your heart and neck vessel. And for me to be able to assess these parts, I'll be touching some certain parts of your body. Specifically your neck and chest area. Will that be okay?
Alright,
So all of your documents and findings in this assessment will be completely confidential.
okay.
So the reason that I asked the client's consent is to gain his trust and cooperation. Okay, sir, I'll be preparing these materials for easier assessment. And can you sit in your most comfortable position, sir? So I position the client to provide him some comfort and clearly see the area that is need to be assessed. Okay, so I'm gonna perform some hand hygiene to avoid any contamination between me and the patient, and close these curtains to provide my patient's privacy. Okay, sir, before we proceed to the assessment, I'll be asking some few questions. Will that be okay?
Okay.
So, did you had recent neck pain?
No.
How about chest pain?
None at all.
Okay, that's good. Did you feel any irregular heartbeat?
No?
How about heart disease? Did you recently?
No, no.
On your family, did any of them experience some heart disease?
No.
Okay. So, do you usually eat food that is rich in cholesterol?
Sometimes, yes.
And do you exercise regularly?
Few walks.
Some walks, okay. So that's it for the question. We move to the assessment, but first I'll put some gloves. Okay, sir. So firstly, I'll be inspecting your jugular venous pulse. So can you lay down, sir? Okay, lay down. Okay.
More?
Yeah, more. Okay. Can you slightly tilt your head down? Yes. So I'll be inspecting your external and internal jugular pulse. So there should not be no visible pulse. Okay. And there should be no distended or no swelling. Now to the other side, sir. Okay. Now I'm gonna ask you to move up a little bit. Now just a little bit. I'll be assessing your, inspecting your jugular venous pressure. So again, look at that. Okay. Okay, there's no detention or bulging. Other side. Okay. Now, just a little, stand up, a little. Again. Okay, no bulging. So there's no distension or no bulging. And lastly, sit straight. Now again, okay. Okay. So I frequently change the angle of the patient to see if there would be some changes or differences that will happen. So there's no distension or no bulging present in the client's jugular venous pressure. So now, sir, I'm gonna palpate your carotid arteries. So can I touch your neck part, sir?
Okay.
Okay. Slightly has some pulse. So the patient has a weak pulse, but it's better to palpate the carotid artery individually to avoid any possible reduced reduce cerebral blood flow. So the strength of my patient's carotid artery is +1, this weak pulse. So now, sir, I'm gonna inspect and palpate your heart. So firstly, we'll inspect the aortic shift located in the right second intercostal space. 1, 2, 3. Next is the pulmonic, the left intercostal space. 1, 2. Okay. Next is the Erb's point, this is the left third intercostal space. 1, 2, 3. Okay. So next is the tricuspid, it's the fourth intercostal space. 1, 2, 3, 4. Okay. Tricuspid. Last is the mitral, which is located in the left fifth intercostal space in the midclavicular line. 1, 2, 3, 4. Okay. So upon palpation, there should be no vibration or no thrills. And I felt some the S1 and S2 in the Erb's point. So did you feel any discomfort during that set?
No.
Okay, that's good. So next is the auscultation of the heart. Auscultation of the heart and rhythm, heart rate and rhythm. I'm just gonna. So the normal heart rate would be 60 to 100 beats per minute, and it should have some regular rhythm. And we should warm the diaphragm of the stethoscope to avoid shocking the patient, as this could alter the heartbeat of the patient. So my patient, his heart rate is 65 beats per minute, as I recorded, and I look at my watch while listening to the patient's heartbeat to determine my patient's heart rate. So lastly, the auscultation to identify the heart sound set, the 5 pillars. Okay. So upon palpation, there should be some normal lub-dub sounds. So first is the aortic. Okay. This aortic has a normal lub-dub sound. Next is the pulmonic. This pulmonic also has some normal lub-dub sound. Next is the Erb's point. Okay, this Erb's point also has some normal lub-dub sounds. Now's the tricuspid. This tricuspid also has some normal lung tone sound. Lastly is the mitral. This mitral also has some normal lung tone sounds. So that's it for this assessment, sir. We are done for all of the tests. And do you have any other questions?
Not at
Did you feel any discomfort throughout the assessment?
No.
So that's it for this assessment. Thank you for your cooperation. Thank you, sir, and have a great day.
Thank you.
Thank you.
Ako.
Kita rin naman.